Our storyboard today is all about Leopold's maneuver. Let us know the step-by-step procedure and how to perform Leopold's maneuver. Preferable formed after 24 weeks gestation when fetal outline can be already palpated. The maneuvers are not truly diagnostic. The actual position can only be determined by ultrasound performed by a competent professional. Leopold's maneuver are a common and systematic way to determine the position of a fetus inside the woman's uterus. Factors affecting the performance of the maneuver: difficult to obese woman, woman with hydramnios. Hydramnios is a condition in which excess amniotic fluid accumulates during pregnancy, and woman with full bladder. Instruct the patient to empty her bladder first. Drape properly to maintain privacy. Explain the procedure to the client. Warm hands by rubbing together. Rub the hands together vigorously to prevent uterine contractions or abdominal muscle tensing. Use palm for palpation and not the fingers. Method of palpation's purpose is to determine presentation and the position of the fetus and aid in location of fetal heart sounds. Assess for the client's age of gestation and urinary bladder fullness. Doing Leopold's maneuver, first, identify the correct patient. Then introduce yourself and state the purpose of the intervention.
Hi, Mrs. Bautista. I am Nurse Skyline. I will be doing Leopold's maneuver, which means I'm going to put my hands on your stomach to determine the position of the baby. Is that okay?
Before and after touching the patient, always do hand hygiene. Assist the client to lie on bed on a dorsal recumbent position. Expose the part to be examined, keeping a cover on the other parts. What lies at the fundus? Face the client's head. Using both hands, palpate the fundal area, determining whether it's head or buttocks. Heads are firm and move independently. Buttocks are soft and moves with the body. It determines the location of the back. The back feels firm and smooth. Extremities are small and bent. This is important to know because this is where we're going to place a heart rate monitor. That's when we're going to get the most accurate heart rate tracing. Determining the part in the pelvic outlet. Head may or may not be engaged. Gonna make an L on our finger and palpate the symphysis pubis, and we're gonna see if we can lift the baby's head up. If we cannot lift the baby's head up, that means the baby is engaged, and if we can and we can move it around, then the baby is not engaged. We call it good attitude if bro respond to the side that contain the elbows and knees. And poor attitude if examining fingers will meet an obstruction on the same side as the fetal back. Fourth maneuver determines cephalic prominence. The bro should be on the opposite side of the back. Starts from the bottom and feel up verifying positioning of the baby. Gently move the fingers on both hands towards the pubis, sliding the hands over the sides of the patient's uterus. The side where the greatest resistance to the descending fingers is the location of the brow. Then, assist the client to get out from bed and keep all materials used. And also, after touching the patient, always do hand hygiene. Record your findings on client's records and refer.